Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Kunney.
Hello, everyone. This is Christopher Kunney, and welcome back to another episode of Straight Outta Health IT. I am so excited today to have as a guest an individual to discuss a very, very important topic that a lot of us don't really think about a lot of times, but is really becoming a very rising issue within the healthcare ecosystem. Our topic today is we're going to be addressing the growing trend of workplace violence against healthcare professionals. You know, in recent years, there's been an alarming increase in workplace violence against healthcare professionals. I mean, this is a very troubling trend, not only that it jeopardizes the safety and well-being of those dedicated to caring for others, but also undermines the overall quality of healthcare delivery. Now, understanding those causes and consequences and potential solutions to this issue is critical for us to create a more safer and more supportive environment for our healthcare workers and the patients. You know, this workplace violence in healthcare setting actually can take many forms. It can be physical assaults, verbal abuse and threatening behavior. And according to OSHA, the Occupational Safety and Health Administration, healthcare workers are experiencing higher rates of workplace violence than any other profession, which is amazing considering we're here to help people. And this violence can, again, come from patients and visitors or even colleagues, just making it such a perverse and complex issue. So I have on the show today one of the foremost experts in this space. And I'm so excited to have Dr. Rhoda Collins, who is a Chief Nursing Officer and thought leader on the topic of nurse workplace violence and prevention on the podcast. Let me tell you a little bit about her. She is a registered nurse for over 3 decades. She was a hospital executive before continuing her evolution to become a leader in healthcare IT. Dr. Collins is a former Chief Nursing Officer for Vocera Communications, where she continued her mission to make technology conform to real-world needs of a hospital, not only the other way around. Her impact is far-reaching and measurable, whether she is leading nursing innovation, redesigning clinical workflow, or speaking to face-to-face with legislators to advocate for policies that put patient safety first. She's also a published author on the topic of workplace violence against nurses, and she prescribes and discusses this topic in a number of different venues, both in conferences, on podcasts, through our legislators, et cetera. So I'm so, again, excited to have Dr. Rhoda Collins as my guest today. Welcome, Dr. Collins. I'm so excited to have you and look forward to having a very lively discussion about this topic.
Thank you so much. I really appreciate it. I appreciate the opportunity to talk about this topic. It's important. It's one of those topics that's been around a while that a lot of people talk about, but the more we talk about it, the more aware the public becomes, and there becomes a more assertive effort toward finding solutions.
No, absolutely. It's kind of like, violence in the home, right? We don't like to talk about that, but it's a subject that we need to bring greater exposure to as well. So I'm very excited to talk about it further. And so before we begin, one of the things I love to do is really ask my guests to really share their story, their journey. Now, why did you get into this space? Why is workplace violence such a passion for you now? Would love to hear a little bit of that journey.
Yeah, thank you for giving me this opportunity. When I started working in nursing, I was a labor and delivery nurse. And I all over West Texas in different hospitals.
Sure.
And you do intersect with domestic violence in those situations. I became very aware of those situations. My journey into technology was, I had 2 patients, only one of the patients I couldn't see.
Right.
It was, we were waiting for it to arrive.
Exactly.
And so we had to rely on technology to tell us about the well-being of the baby.
Sure.
And so those 2 things over my career just intersected. I was the vice president of the Women and Children's Hospitals at Baylor in Dallas. And again, more and more became involved in that. And then eventually I just had the opportunity to go into the healthcare industry, working in technology, software solutions for healthcare, because I was so committed So technology has to work for the people who use it.
That's right. Absolutely. It has to be the enabler.
Yes,
right?
that's right. It was really my passion. And then probably in somewhere around 2012, 2015, in that era, I was spending a lot of time speaking and talking to nurses, and workplace violence always came up. It
Oh, that's
always
interesting.
was on the
Really?
agenda. Mhm.
Wow.
And I had not been working in the hospital at that time for over a decade. And I thought, wow, this problem has not been solved.
Yes.
And so I really started diving into it, and I came to understand that it had a bit of a shame factor to it.
Mhm.
It had a little bit of folks, leadership didn't really know what to do about it because it felt out of control.
Sure.
And nurses were becoming really frustrated with the environment, that
Exactly.
it was not being managed well. So
Right.
that's when I started focusing on it and really diving into trying to find solutions for it.
I'm curious, and you can always push back on this on my show, so feel free to do that. But I am going to ask just some questions that may be uncomfortable sometimes. Did you personally experience any workplace violence?
I have had one experience where a father pulled a knife out of his pocket because his wife was hurting, and he did not want me adding to that discomfort at all. And he was under the influence of alcohol at the time.
Exactly.
And I had to step out of the room, leave the patient with the situation so I could call security. But yes, that was early on in my career, and it was really destabilizing. I
can imagine, I mean, you're trying to take care of a woman that's obviously about to deliver a child, and her husband is threatening you, and you're concerned about the baby and the mother, and yet you're having to leave their bedside to have him removed, which is going to probably even create an even more upsetting situation.
Yeah. And you find yourself, you don't want to shout for help because you don't want to inflame the situation.
Sure.
So you find yourself just stepping out and grabbing people as quickly as you can and rallying the people around you to help with the situation. Mm-hmm.
So tell me, let's kind of dive deeper into that. What are some of those, and I kind of gave a high level overview, but what are some of the types of workplace violence that nurses have shared with you that they have experienced?
Yeah, there's so many examples of it, but I think probably the most predominant form of workplace violence is patients yelling and hurling abuses and foul language and threatening, all of those. And then, of course, there's physical assault. And then there is, to some degree, although I will say, the arena of this, strides have been made in lateral violence, which is coworker-to-coworker and things like that. And most of the time, very much most of the time, it's verbal abuse.
Exactly.
But we've had a lot of focus on stopping bullying in the workplace. It's everywhere, not just in healthcare, that has been focused on. We've been focusing on calling for help when you need it, not treating it as a shameful event that somehow you must have been responsible for and you didn't control well, which has really been the culture of dealing with the events. It's like, how did you let that happen? How did you let it get to that point? And nurses, in fact, I just saw a meme this week. And it was on a nurse chat board. It said, if a police officer is punched by an individual, they're arrested. If someone in the public is punched, they're arrested. If a nurse is hit by an individual, then at the bottom it said, management says, how could you have prevented this?
Oh, wow.
So that's traditionally the culture, because this is your patient. You should be caring for your patient. And you're responsible for that. So there always has been a bit of shame attached to it that I let this happen, but we're understanding better and better and better. You didn't let this happen. This is
you're the victim, right?
Exactly.
Yeah, you're the victim.
100%.
That's so interesting. I'm a recovering CIO, and I've worked in a clinical setting. Personally, I've seen some verbal abuse between clinicians, doctor to nurse, and maybe nurse to nurse in some cases, but mostly doctor to nurse. What do you think are some of the root causes of, specifically colleague to colleague, what do you think are some of the root causes to why someone feels like they are emboldened to abuse another coworker?
Stress. It would be a prominent force behind that, because I also think that we have traditionally, not well managed behavior in the past. We need to, all of us are focusing on it more. You can think about 10 or 15 years ago in the workplace, even that you were, how people responded to each other was very different.
So tell me, what was that difference? What was it like 10, 15 years ago? And then what changes have you seen happen today?
I think the focus on diversity and inclusion and respect for other people and respect for what everyone brings to the table in this melting pot world that we live in had a disciplined approach to it.
Right.
And through that education and through understanding how we're all different, but we all bring our particular talents and knowledge to the table, there's a drive where if someone's not understanding, you educate, you don't yell at them.
That's right.
If someone is frustrated by the situation, they're not understanding, you explain it to them.
Exactly.
And so I do think that there has been a huge focus just across the board, culturally, everywhere to focus on that. And it has made a difference.
Sure.
I do think that, as always,
it's a generational thing. I mean, I'll be the first to admit, I'm the last generation of baby boomers. So I'm old school. I do think that, younger generations have grown up in a more inclusive and less hierarchy of a world, and so, they treat it very, very differently. And there is a more respect. Yeah,
that's right. And then on the other side, there's always, it doesn't matter who they are, there's substance abuse and stress and, personal issues and all of those kinds of things.
Right. Absolutely. So, fast forward, 2024, healthcare organizations are now more aware of this as a common thing that's happening. I'm curious, what are you seeing has been some of the policies or measures or activities that these organizations are starting to implement to begin to try to, flatten the curve around some of this patient to provider and then provider to provider?
Yeah. So all of our professional organizations in nursing, like the American Organization of Nurse Leaders, American Nurses Association, Emergency Nurses Association, all of these organizations are focused on it. As you can imagine, the ENA, or Emergency Nurse Association, is heavily focused on it because that is usually the first entrance into the hospital for a patient. And they frequently encounter situations. Also, behavioral health is an area of common incidents. But I think that the Joint Commission has set forth rules and guidelines for preventing workplace violence that hospitals have to meet, and implications of that. Professional organizations are doing the same. There is dialogue, in the legislative arena about bills to prevent workplace violence.
Right.
And then you add into that, when you start tracking, or you have wearables for folks who can call for help in the moment. They don't have to step out of a room. They don't have to look for somebody to help them and leave the patient in a situation if they can even get out of the room.
Right.
Sometimes they're in a headlock. Right. And so I think that all of these together have definitely made huge strides in talking about workplace violence. I think the other thing is that it's sort of come out from under the porch, as we say in the South.
Exactly.
Where we brought it out from under the porch, put it on the front porch, and we're all talking about it.
Right. Absolutely.
So that makes a difference for people to feel free to report. When OSHA says 80% of incidents are not being reported, and they still maintain that's a good number, right?
Yeah.
That is because, that's because the culture the individuals are working in discourage it. If they do report, it's a punitive response.
I was going to ask you, is there a punitive reaction? And then they're
what did you do wrong?
Or whatever. Exactly. And now we're managing them out of the organization because they're a whistleblower.
That's right. And so what we look at is, how do we change that? Early on in the 60s and 70s, when medication errors were made in the hospital, it was a very punitive experience. I mean, it was, people were brought before councils. They were in danger of losing everything. So they just didn't report it. And so you would have these incidents where patients were not doing well, and you'd come to find out, well, they didn't report a medication error. So we made a huge effort in hospital leadership to remove the punitive experience and make it an educational experience.
Exactly.
You know, if a patient error was made, was the order written wrong or in a difficult way to decipher? Electronic health records have made a huge difference in reducing that error. You know, just all of these things that we looked at, and then people were okay reporting. You know, it's okay. Okay, the sky's not going to fall if I report. And I see now we're doing the same thing with workplace violence. We're making it where it's not this negative experience to report. So as we get better and better and better at that, and hospitals get better and better, and we provide more robust solutions like technology solutions to call for help, then folks are more and more willing to be open about it.
No, that's great. And I was going to, you touched on it there just a second, how is technology starting to impact us in a positive and or negative way? You mentioned technologies like Coursera, for example, where you have the ability to press the button and talk to someone right there without having to leave the room. The ability to call for help, medication reconciliation, for example, help with medication errors. I'm just curious whether are there other technologies, AI or whatever you might be seeing today that you're seeing having an impact, again, whether it's positive or negative.
Yeah. So what I do today at Cont.io is basically we find people, places, and things to protect someone from injury or arrive when they need help is to know where they are. Right. So that's one of the primary.
What does that mean, know where they are?
You have to know where they're located. Are they
geographically located?
Yeah. I mean, where is this call coming from? And is it absolutely accurate to room level, or is it just off of access point?
Exactly.
General vicinity. What I'm doing today is working to put duress technology on all healthcare workers so we can find them exactly where they are when they press a discrete button. And they don't have to call. They don't have to inflame the situation any further. They can just press the button and immediately security and coworkers and people know that they're in trouble. They need help.
Absolutely.
And so when I look at that, if you have the technology to find people, places, and things, then the AI, it has the ability to create this operational excellence environment where you're not looking for equipment or people.
Right.
Patients.
That's right.
Because patients wander.
The human factor.
Right. And so you decompress the environment by having the data to know where hotspots are, the data to know where people and things are, that sort of thing. So that's how technology really plays into it. And it just enhances the policies and protocols that hospitals may have already to prevent workplace violence. But now we can find you. Now we can find the patient, and we can use artificial intelligence then to provide machine learning from large amounts of data that tell us exactly how your hospital, is it wait times? Is it the specific departments? Is it specific areas of the hospital that are not well monitored? Right. Those sorts of things.
Yeah, no, that's great. I was going to ask you, how are we now taking all of this data we're collecting to understand the root causes of workplace violence? And you shared a few of those. And if there are others you want to share, please do. I'm curious too, on the reverse, do you see a growing trend around the clinician abusing the patient?
No.
So you're not seeing that. Okay.
No.
That's good.
That is a rare made for TV movie.
Right. Well, that's good to hear,
Yeah.
I do not want to get beat up by my clinicians.
Yeah. That's a rare event.
Okay, that's great. You touched a little bit on OSHA and some of the other kind of governmental regulatory bodies. I'm just curious, what are the legal protections an individual has in the workplace that they may or may not be aware of to hold individuals accountable for abusing them? Any
right. That I will say, I have seen hospitals individually sort of across the country. I've seen them in Texas, in Maine, hospital in Maine and then a hospital in the Midwest in Chicago.
Right.
They've actually fired patients from their healthcare system.
Oh, interesting.
They've
Really?
been so abusive to our staff.
Right.
Who are not welcome back in our facilities. And
can you
the hospital
legally do that?
What? Yeah, they can.
Wow. Okay.
Yes. And the hospitals use their legal expertise and send formal letters and just say, you have a history of abusing and re-abusing, and for that reason, you have to seek care elsewhere.
Wow. Well, that's good to know. I for those who are listening that may not have known that, you can actually push back and tell these folks to pound salt, right?
Yeah, you sure can. And many hospitals are bringing their local law enforcement into the situation. So when there's an event, not just hospital security sort of behind closed doors managing it, but bringing it into the community. So everyone is aware of the incidents. There was a nurse in Texas in the emergency room who her last memory is leaning across the patient who was there complaining of a GI issue.
Right.
She leaned across the patient to adjust an IV line or something, and that is her last memory. And she literally woke up 5 days later. She was found on the floor of the treatment room. The patient had just beaten her, and she had skull fractures. And I mean, she was in the hospital for days.
Oh my goodness.
And so those are the kinds of situations that you just, you can't tolerate. You have to
hold them accountable.
And as you become more comfortable with, we're addressing this properly through measures, then you're able to, write those policies or take those actions or do those things you need to do. And I do think that it's really healthy for the workforce. I mean, the workforce is exhausted right now.
Oh, absolutely. Yeah.
They've been working
out every day, right?
Oh,
yeah.
It's just, my daughter was an emergency room nurse. She was a paramedic for 8.5 years, and she was an ER nurse, and she is now working for a software company.
Right.
And she goes, COVID broke me.
Right.
Just the constant, just the enormous amount of hours they had to work, all of that. And just yesterday, I heard about a nurse who drove off the roof of the parking garage because she was so exhausted when she finished her shift. She got in her car and the car was not in park, or she had taken it out of park, and she fell asleep. I mean, just in that instant, fell asleep, and she was badly hurt. But this is what we're talking about. We're talking about an exhausted, worn down, frustrated, workforce.
Sure.
That needs the people who have the energy to stand them up, them up.
Right.
And that's why I look for, if people aren't there, do we have technology solutions to give a bit of comfort and a bit of, look, I have protection here. I feel good about this. I'm happy to wear this. Everybody knows where I am. I had a nurse say to me at one of the conferences I spoke at, she said, every night when I leave for work, because she works nights in the ER, she said, I kiss my family goodbye like it's the last time I'll ever see them. Oh my
God, really? Really? It's like a war zone now.
I mean, she said, I treat it like it's the last time I'll ever see them. She was so sincere in how she stated it. And I thought, this is a topic that we just can't look away from. We have to continue. And that's why I'm so committed using technology, using policy, using everything that we have.
Yeah. And no one that has made it their mission to take care of others should be going to work thinking they're going to lose their life, or they may never see them.
100%.
What a shame. So many other questions, but it's a 30-minute podcast. So I want
That's all right.
That's right. We're knocking on that door right now. And I want to give you a couple minutes, one, to talk about any kind of final thoughts you have about what the industry can continue to do and double down on to address workplace violence. If you had anything you wanted to share about what you're doing today, your current role, please do that as well too. And then kind of just any closing thoughts you might have about how our listeners can get help or advocate for the healthcare professionals in this space.
That's right. I think one of the reasons that I do what I do is because I believe it can make a difference. I've really tried in my career to align myself with solutions and technologies that I think can make a difference in practice.
Exactly.
Because that's something thing that I'm committed to. So what we do at Contact and finding places, people, and things aligns very well with that. And it creates operational excellence. It creates safety for both the patient and the caregivers. It creates intelligence and knowledge so hospitals can understand how do they really work. Because I don't think that we have the answer to that.
No, we're still on a journey, right?
We create a form until we figure it out.
Exactly.
And so those are some of the things that I've been really passionate about, and I continue to be passionate about, and I feel like we're solving for. The other side of it is I think that there's 32 states that actually have made workplace violence in healthcare a felony.
Oh, wow.
That's only 32 out of 50.
Right. Well, yeah, at least we're moving in the right direction, right?
We're moving in the right direction. Right. So I would just encourage everyone to find out if there's such a law in your state. Contact your senators. It passed the House. It's in the Senate now. From a federal level, I feel like we have to have a consistent federal solution. And looking for help, I would say the people who have really brought in experts and have policies and knowledge and work kits, toolkits, are people like the American Nurses Association, the American Organization of Nurse Leaders, Emergency Nurses Association. All these people have, it's come from experience in trying to solve the problem. So they really do have wonderful tools. The CDC has assessment tools to assess for a patient that may be at risk of being violent. And all of those are free. You can just download those and integrate those into your assessment process.
No, that's great. Well, that's wonderful information. And this all will be in the transcript as well, too. So folks, if you're interested in getting more information about those associations, and then if someone wanted to touch base with you specifically, and they wanted to learn more about what you're doing and seek your guidance in this area, how would they reach you?
Yeah, you can reach me easily on LinkedIn. I usually respond. It may take me a day or two, depends on if I'm traveling. And also go to our website, contact.io. It's spelled with a K, KONTAKT, .io. And you can put in a request to speak with me there, and I will happily respond.
Wonderful. Well, what an amazing conversation. And there's so many layers to this that, I'd love to have you back and peel back the onion even further. And some areas that I think, are definitely worth exploring further. So we're going to have her back, everyone, back on the program sometime in the near future. I just
would love that. Thank you.
Yeah, would love to have you as well, too. And so, this growing trend of workplace violence against healthcare professionals is absolutely a pressing issue. And it's surprising to me that it is as prevalent as it is, but it does demand really immediate attention and action. And we got to understand the root causes of these issues and implement, real comprehensive strategies, legislation, and education and accountability to create a more safer and supportive environment for those who've committed their lives to taking care of others. I think it's all of our responsibility, both, the community, the patient, the care providers, the administrators, our legislative officials, to ensure that healthcare professionals perform their duties without fear by enhancing the overall quality of care for patients, by protecting their ability to do that in a very safe and inclusive environment as well, too. So I encourage everyone out there to become an advocate around this. Talk to your legislators, talk to your local healthcare leaders, get involved in these associations who are advocating for, workplace rights. And let's create a better environment, because we cannot afford to lose any more healthcare professionals. It is a crisis right now. And shame on us if we lose them to their fear for working in an environment. That is such a shame. Well, that's it, guys. Thank you so much for taking time out of your busy schedules to join us today. And thank you so much, Dr. Rhoda Collins, for your insights and commentary on this very important subject. Again, really, really appreciate you sharing that with us. And as always, everyone, your comments and feedback are welcome. Please reach out to Dr. Collins for any insights and follow-up you might have. She's given her permission to bombard her LinkedIn account. So let's make this, let's go viral with this podcast. Let's become a part of the army of folks who are going to solve this problem as well. Thank you, everyone, for your time and attention. As always, appreciate your support, and I'll see you on the next episode of Straight Outta Health IT. Take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Kunney on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.